A patient with persistent tachycardia has a wide QRS complex. What is the first recommended action? A. Start chest compressions immediately. B. Give adenosine without checking rhythm. C. Obtain 4-access and consider antiarrhythmic infusion. D. Defibrillate at 200 joules. Answer, C. Wide QRS tachycardias require 4-access and preparation for antiarrhythmic therapy. Immediate defibrillation is reserved for unstable pulseless rhythms. Which medication is the first-line drug for symptomatic bradycardia? A. Amiodarone. B. Atropine. C. Lidocaine. D. Dopamine. Answer, B. Atropine is the initial treatment for bradycardia. If it is ineffective, dopamine or epinephrine infusions and pacing are considered. A patient in cardiac arrest has pulseless VT. What is the next step after the first shock? A. Give amiodarone. B. Start CPR immediately for 2 minutes. C. Insert advanced airway. D. Give atropine. Answer, B. High-quality CPR should be resumed immediately after a shock. Medications like epinephrine or amiodarone are given during subsequent cycles. Which is the most reliable method to confirm endotracheal tube placement? A. Chest rise observation. B. Colorimetric CO2 detector. C. Continuous waveform capnography. D. Auscultation of lung fields. Answer, C. Continuous waveform capnography is the gold standard for confirming ET tube placement. Other methods provide additional support but are less definitive. What is the recommended dose of epinephrine during cardiac arrest? A. 0.1 mg for every 5 minutes. B. 1 mg for every 3 to 5 minutes. C. 10 mg for every 2 minutes. D. 2 mg for every 10 minutes. Answer, B. Epinephrine is given at 1 mg 4/IO every 3 to 5 minutes during cardiac arrest. This dose helps increase coronary and cerebral perfusion. In an adult cardiac arrest, what is the correct compression to ventilation ratio without an advanced airway? A. 30:2. B. 15:2. C. 5:1. D. Continuous compressions without breaths. Answer, A. For adults, the recommended ratio is 30 compressions to 2 breaths when an advanced airway is not in place. A patient with ROSC after cardiac arrest is unresponsive and has no purposeful movement. What is the next best step? A. Begin targeted temperature management. B. Administer atropine. C. Give immediate amiodarone infusion. D. Start hyperventilation. Answer, A. Targeted temperature management improves neurologic outcomes in comatose post-arrest patients. Hyperventilation should be avoided as it reduces cerebral blood flow. Which rhythm requires immediate synchronized cardioversion? A. Asystole. B. Stable atrial fibrillation. C. Unstable supraventricular tachycardia. D. Ventricular fibrillation. Answer, C. Unstable tachycardias, such as SVT with hypotension or chest pain, require synchronized cardioversion. Defibrillation is used for VF or pulseless VT. Which action is part of high-quality CPR? A. Compressing at least 2 inches deep in adults. B. Interrupting compressions every 20 seconds. C. Allowing no chest recoil. D. Giving slow, shallow breaths. Answer, A. Effective CPR requires compressions at least 2 inches deep, full chest recoil, minimal interruptions, and appropriate ventilation. In bradycardia with poor perfusion unresponsive to atropine, what is the next recommended intervention? A. Immediate defibrillation. B. Synchronized cardioversion. C. Transcutaneous pacing. D. Give lidocaine. Answer, C. Transcutaneous pacing is indicated if atropine fails in unstable bradycardia. Dopamine or epinephrine infusions may also be considered. Which medication is recommended for refractory ventricular fibrillation? A. Atropine. B. Adenosine. C. Amiodarone. D. Dopamine. Answer, C. Amiodarone is given for VF or pulseless VT unresponsive to CPR, defibrillation, and epinephrine. It stabilizes cardiac electrical activity. Which airway device is considered a supraglottic airway? A. Endotracheal tube. B. Nasopharyngeal airway. C. Laryngeal mask airway, LMA. D. Oropharyngeal airway. Answer, C. The LMA is a supraglottic device providing ventilation without ET intubation. It is useful in emergencies or when intubation is difficult. During cardiac arrest, when should rhythm checks be performed? A. Every 30 seconds. B. After every 2 minutes of CPR. C. Continuously without pause. D. Every 10 minutes only. Answer, B. Rhythm checks are done every 2 minutes during CPR, minimizing interruptions to compressions. A patient with stable atrial fibrillation lasting greater than 48 hours requires cardioversion. What must be considered first? A. Administration of epinephrine. B. Anticoagulation therapy. C. Atropine pretreatment. D. Use of lidocaine. Answer, B. Anticoagulation is required before cardioversion in atrial fibrillation lasting over 48 hours due to stroke risk. Which is a reversible cause of cardiac arrest, H's and T's? A. Hypertension. B. Hypovolemia. C. Hyperventilation. D. Hyperactivity. Answer, B. Hypovolemia is one of the reversible causes of cardiac arrest. Identifying and treating H's and T's improves survival chances. Which is the first drug given after the second defibrillation in cardiac arrest? A. Amiodarone. B. Epinephrine. C. Atropine. D. Dopamine. Answer, B. Epinephrine is administered after the second shock in VF/pulseless VT, followed by amiodarone after later shocks. Which oxygen delivery device provides the highest concentration of oxygen? A. Nasal cannula. B. Simple face mask. C. Bag mask device. D. Non-rebreather mask. Answer, D. A non-rebreather mask provides nearly 100% oxygen concentration, higher than simple face masks or nasal cannulas. Which statement is true about defibrillation? A. It is used for unstable bradycardia. B. It is synchronized with the patient's QRS. C. It is indicated for VF and pulseless VT. D. It prevents ROSC. Answer, C. Defibrillation delivers an unsynchronized shock to terminate VF or pulseless VT, restoring organized cardiac activity. Which intervention is most important immediately after ROSC? A. Begin targeted temperature management. B. Optimize ventilation and oxygenation. C. Start immediate defibrillation. D. Give atropine. Answer, B. Post-ROSC care prioritizes oxygenation and ventilation. Once stable, targeted temperature management and other interventions follow. What is the recommended compression rate during CPR? A. 60 to 80 per minute. B. 100 to 120 per minute. C. 140 to 160 per minute. D. 180 per minute. Answer, B. The correct compression rate is 100 to 120 per minute. Faster or slower rates reduce CPR effectiveness. During synchronized cardioversion, which arrhythmia is most appropriate to treat? A. Asystole. B. Pulseless ventricular tachycardia. C. Unstable atrial fibrillation with rapid ventricular response. D. Normal sinus rhythm. Answer, C. Synchronized cardioversion is used for unstable tachyarrhythmias with a pulse, such as atrial fibrillation with rapid ventricular response, atrial flutter, or unstable supraventricular tachycardia. Which drug is preferred for the initial treatment of symptomatic bradycardia? A. Epinephrine. B. Dopamine. C. Atropine. D. Amiodarone. Answer, C. Atropine is the first-line medication for symptomatic bradycardia because it blocks vagal stimulation of the heart, increasing heart rate. A patient in ventricular fibrillation has received one shock. What is the next immediate action? A. Give amiodarone. B. Resume CPR immediately for 2 minutes. C. Administer atropine. D. Check for a pulse. Answer, B. After delivering a shock for VF or pulseless VT, high-quality CPR should be resumed immediately to maintain perfusion without delay. What is the recommended initial dose of adenosine for supraventricular tachycardia, SVT? A. 6 mg rapid 4 push. B. 150 mg over 10 minutes. C. 0.5 mg 4 bolus. D. 1 mg every 3 to 5 minutes. Answer, A. The initial adenosine dose for SVT is 6 mg rapid 4 push followed by a flush. If ineffective, a 12 mg dose can be given. What is the correct compression to ventilation ratio for an adult in cardiac arrest with no advanced airway? A. 15:2. B. 30:2. C. 10:1. D. Continuous compressions with no breaths. Answer, B. For adults without an advanced airway, CPR is performed at 30 compressions followed by 2 breaths to ensure adequate circulation and oxygenation.